So yesterday we have discussed some points in the Kashyapa Samhita and the modern points also. So we have to continue the further points in the pediatrics. Okay. So we have to start with the cephalic tetanus. Here, the cephalic tetanus is a rare variety of the tetanus, and here the paralysis of one or more of the cranial nerve is happen. Okay, usually the seventh cranial nerve paralysis is happen in the cephalic tetanus. Then, next important disease you have to remember is the neonatal hyperbilirubinemia. Here, the ABO incompatibility is the cause for the physiological jaundice. Okay, so the clinical jaundice is mainly started in the first 24 hours of the life. Okay, it is pathological. And whereas if the jaundice appear beyond the 24 hours to 72 hours, it is physiological jaundice. So it is very important. So the physiological jaundice has not any clinical importance, but it appears beyond the 24 hours to 72 hours. Okay. Whereas in pathological jaundice, the clinical jaundices occur within the 24 hours of the after the birth. Okay, within the 24 hours of the birth. Then, if the jaundices appear beyond 72 hours to 2 weeks, the common cause is septicemia or any breast milk jaundice. So these are the two causes for the jaundice, which is appear beyond the 72 hours within 2 weeks. Okay. So you have to remember the time of origin of each jaundice. It is always asking questions. Okay. And next, that is the diarrhea and dehydration ORS content. Here, you have to remember the ingredient of the ORS. Mainly, the NaCl is present in 2.6 gram. So, mark this as 2 star because the quantity of NaCl in ORS is always asking question. And the another ingredient is KCl, which is of 1.5 gram in quantity, and trisodium citrate in 2.9 gram, and the glucose, which is present in 13.5 gram. So mainly in ORS, glucose content is more, which is in 13.5 gram. Okay, and also water in 1 liter of quantity. Then yesterday we have discussed this chromosomal disorder. I hope that you have understand that. Then we have to study some important signs and the specific diseases. These are very important. Okay, the first one, that is Trousseau and Chevaux-Tex sign, which is present in VDDR type 1 disease. And in the second one, that is sunset sign that we have studied yesterday, which is present in hydrocephalus, where the sclera is present above the cornea. And the next is Gower sign, which is mainly present in the muscular dystrophy. Due to the weakness of pelvic girdle muscles, the Gower sign is, that sign is known as Gower sign. Okay. And next, that is the double gas bubble sign. It is found in duodenal atresia. The other one, that is bronze baby syndrome. It is a rare to excessive phototherapy. Due to the excessive phototherapy, there is a cause of bronze baby syndrome. And next important sign, that is Hutchinson's teeth. It is mainly found in congenital syphilis. Okay. So that is marked as 3 star, Hutchinson's teeth, which is found in congenital syphilis. And the next sign, that is Mace-1 sign, otherwise known as crackpot resonance, which is present in hydrocephalus. So in hydrocephalus, we have to find 2 signs. One is crackpot resonance and other is sunset sign. Okay. And in pneumonia case, there is a the shape of the chest is in barrel shape, and whereas in rickets, it is a pigeon chest or fiddle shaped chest is present. And also we have discussed in kashyapa. Yesterday we have studied about the kashyapa, isn't it? So the main sign is present is flag sign, where the formation of alternate band of light and dark color is present. Okay, it is the main symptom or main sign present in the kwashiorkor. And also the kerning sign is positive in tetanus neonatorum. So mainly meningitis, and in tetanus neonatorum the kerning sign is positive. So here we can find the rigidity of neck. Okay. And other sign, that is X-ray of cupping and saucer like epiphyseal end, is mainly seen in rickets. Okay, so in rickets, pigeon chest, and also in X-ray, the cupping and saucer like epiphyseal end also can be seen. Then other important sign, that is Wimberger sign. It is seen in the knee X-ray, that is the bilateral erosion in the upper medial end of the tibia, which can also seen in congenital syphilis. Okay, so Hutchinson's teeth is seen in congenital syphilis. Also, the Wimberger sign also can be found in congenital syphilis. And hair on an appearance in X-ray can be seen in thalassemia. And in case of scurvy, it's a disease produced due to the deficiency of vitamin C. Here, the ring-like epiphysis can be seen. And other signs are Palken sign, which is the marginal spur formation can be seen. That is Palken sign. Whereas the corneal sign, here the marginal cleft and subperiosteal hemorrhage can be seen. That is corneal sign. And here also the Wimberger sign can also seen, where the increased zone of calcification can be seen. So this Wimberger sign is present in both congenital syphilis and in scurvy. Okay, right? Then, so you in this portion you have mainly you have to study the Wimberger sign and the flag sign, kerning sign, and crack spot resonance, Hutchinson's teeth, and Gower sign and sunset sign. These are the important signs you have to remember. Okay. Next, the commonest malignancy is mainly found in a child is leukemia. And the commonest pediatric disease is upper respiratory infections. Okay. In case of what is the common tumor that is found in a child is lymphoma. Okay. Then next, the commonest tumor of the connective tissue is sarcoma. Just remember these things in 1-star important. Okay. Mainly malignancy, common malignancy is leukemia, whereas the commonest tumor in the child is lymphoma, and the common pediatric disease is URI. Okay. Then the commonest cause where the hemoptysis is found in the child, it is mainly due to the pneumonia. The main cause is either it may be due to pneumonia, and the hematomesis, that is the vomiting of the blood, is mainly present in infant due to the acute duodenal ulcer. These are the commonest cause. Okay. Some other causes may be present, but mainly the commonly these symptoms are found in this disease. Okay. And if there is a bleeding per rectum, is fine. It is due to the fissure in ano. And it may be also present in case if the bleeding per rectum is present in a child, it may be due to polyp. And if the baby is constantly crying, commonly it may be due to hunger. Or if there is any large intestinal obstruction is present, it may be due to the hairspring disease. So these are the commonest cause. Also mark this as 1 star important. Okay. And next important point, the 3-star important point, that is the newborn will pass the urine after the birth within 48 hours, whereas the newborn will pass the stool within 24 hours. This is very important. And the first stool passed is known as meconium. Okay. Then the posterior frontanelle is closed at the 4th month, and the anterior frontanelle is closed at 9 to 18 months. And if any depression can be seen in the anterior frontanelle, is mainly due to the dehydration. Okay. Then the commonest heart disease in the newborn is RHD, that is rheumatoid heart disease. Okay. And the kwashiorkor that we have discussed earlier, that is, it is due to the deficiency of protein, and flag sign can be seen. Whereas the marasmus is the deficiency of carbohydrate. Okay. The marasmus is due to the carbohydrate deficiency. You can remember it as with a code, my car, MA, my car. Carbohydrate deficiency is present in marasmus. Okay. Whereas in kwashiorkor, deficiency of protein can be seen. Then another important point, that is breast milk does not contain vitamin K and vitamin D. Okay. So last class we have discussed the what are the things present in the colostrum and the breast milk, and the breast milk composition has been studied. So the breast milk does not contain vitamin K and D. And the common causative factor for the tonsillitis is streptococci. Mainly it is present, it is caused due to the streptococci bacteria. And in case of the common congenital anomaly of the kidney that is mainly present is polycystic kidney. So these are of 1 star important. Just read it. Okay. And then the cleft lip is repaired in neonatal period and within the 6 months, whereas the cleft palate is deferred until 1 year or 12 months. Okay. And in case of pneumonia, the rusty sputum also can be seen, that we have studied now. Okay. And the port belly is normal up to 5 years in children. And the umbilical hernia is seen in 2 years, 3 years, up to 4 years. Okay. And then this composition of breast milk colostrum, that all we have discussed yesterday. And also the drug doses, the dosage formula, mainly Young's formula, Billings formula, we have discussed. And 2 more formula is there, that is Freight formula, that here the dosage is mainly count by age in months divided by 150 multiplied by adult dose. Okay. Whereas the Clark formula is calculated with the weight in pounds by 150 multiplied by adult dose. Okay. So Clark formula is measured in pounds. Just remember that. Okay. So these are some important points. And coming to the next disease, that is Duchenne-Erb's paralysis, which is a birth defect. Here, the brachial plexus is comprises chiefly, where it consists of the spinal nerves coming from C5 to T1. So here, the injury to the brachial plexus is occurred due to the birth injury, resulting in the diseases are mainly Erb's palsy and Klumpke paralysis. Okay. Then the main cause is due to the dystocia is the main cause, and other causes are excessive pulling of the shoulder in vertex position. So Just remember the Erb's paralysis is mainly due to some birth injury. Okay. And here you can see waiter's tip position. What is that? The affected arm is adducted and it is internally rotated with the elbow extended. That is known as waiter's tip position. So it is mainly seen in Erb's paralysis, waiter's tip position. And forearm is prone and wrist is flexed. Okay. And here also atrophy of deltoid muscles, biceps and brachialis muscle can be seen. Okay. Then other congenital defect is ventricular septal defect, otherwise known as VSD. It's a congenital heart disease where an abnormal communication is present between the two ventricles. So, mark this as 2-star important. Okay. Ventricular septal defect. So there is a communication present between two ventricles. It is congenital anomaly of the heart. Okay. Then it is mainly 3 types, that is central muscular, marginal muscular, apical muscular, and the type is mainly foreign number, that is perimembranous type, inlet VSD, outlet VSD, and muscular type. Then the muscular type is further divided into 3, that is central, marginal, and apical. Okay. So mainly you have to study the type, that is in 4 in number. Okay. The clinical manifestation. What are the clinical manifestation in ventricular septal defect? Mainly the patient is asymptomatic if the septal defect is very small and the patient is normal. And when it is in moderate to large septal defect is present, there may be repeated pulmonary infection and decreased exercise tolerance and their failure to thrive. That means poor weight gain is present. And also pulmonary hypertension can be seen in that child. So on examination, what we can find is that there may be tachypnea and death may be due to CCF, that is congestive cardiac failure. Okay. So if a baby is coming with a repeated pulmonary infections and with exercise intolerance, then just make it differential diagnosis whether he have any VSD. Okay. And other congenital anomaly is tetralogy of the fallet, TOF. So this is a combination of 4 type of congenital anomalies of the heart. The mainly right ventricular outflow tract obstruction and ventricular septal defect, dextroposition or overriding of aorta, and also right ventricular hypertrophy. So these 4 types are collectively known as tetralogy of fallet. Okay. So the babies mainly show a slight cyanosis at the time of birth, and also the exertional dyspnea may be present, and squatting and hypoxic spell will be developed later. Okay. So just you have to remember what are the 4 type of congenital anomalies in TOF. Okay. This is the important thing. Then other point that is explained in Bhaishya Ratnavali is the Jala Shirshagam. You may be heard about this disease, Jala Shirshagam. This is a Sanskrit word coined for the disease hydrocephalus in modern science. Okay. So in Ayurveda, this disease is mentioned as Shirshambu in Bhaishya Ratnavali textbook. Okay. What is Jala Shirshagam? There is an abnormal accumulation of the ambu or jala in shiras. Okay, that is happening with its secondary clinical manifestation. So due to the abnormal accumulation of this water in the shiras is a cause for jala shirshakam. So basically the hydrocephalus is caused due to the imbalance of CSF production and its absorption, or by an obstruction in its path of flow. So we can term it as the adipravarti of the CSF, or anywhere the sangha or any obstruction may be present on its path. Okay. So these are the main causes for the Jalashirshagam or hydrocephalus. So in Bhaishya Ratnavali, the Nidana for the Jalashirshaka is mentioned as Dushta Ambu Panat Adishaityadova Andhra Krimer Udbhavado Abhigadat Asatmya Bhojanat Ashnadaha Suraya Atyartha Panat Pavana Pradoshat. And so these are the things that are due to the intake of cold or contaminated water, or some trauma may be present, or parasitic infections, or excessive alcohol use, and intake of apatya, which causes the vada vitiation, and also it may be associated with the teething. Then the susceptible age group for developing this hydrocephalus, it can be developed at any age, but mostly is present in childhood period. Prayaha shishunam ubajayade aso bahalye vayasyeva gado vishesha. So it is mainly occurring in childhood period. Okay. And here you can see the samprapti of the hydrocephalus. Either the adipravarti of the CSF, or maybe sangha. Either in the path of the flow there is obstruction, or at the site, absorptive site, there may be obstruction. So these two causes will result in accumulation of CSF in the ventricles. Okay. Then coming to the prognosis, it is duschigilsya. The treatment, Ayurveda treatment is result is very poor. That is duschigilsya. And here also some purvarubhas are mentioned. You just read through these points. Okay. And also mention the ruba, the symptoms. The main symptoms of Jalashirshaka is severe headache may be present due to the increased size of head, and blackish feces may be present, and scanty urine. Burning sensation in the eyes and ears may be present, and the baby may have rapid pulse. Okay, vomiting. Vomiting is an important symptom, and also discoloration of face can be there, and itching over lips may be present. Okay. Then coming to the chigilsa, the mainly we used Mutrala and Rejaga drugs in order to remove the excessive accumulation of CSF. Mutrala and Rejaga drugs are used. So the hair should be removed and the head covered with a warm cloth. And administration of coconut oil can be done. And a small dose of Rasasindura is to be taken twice or thrice daily. So mainly Mutra Pravartaka drugs are used in the treatment of hydrocephalus. Okay. Then coming to the modern part, that is hydrocephalus is mainly the accumulation of CSF in the ventricles of the brain. Due to the etiology, it may be congenital or acquired hydrocephalus. So the congenital hydrocephalus is maybe due to the CSF flow obstruction due to any ductal stenosis, or Arnold-Chiari malformation, Dandy-Walker malformation, and some intrauterine infections and intracranial bleeds, congenital tumors. Okay, the congenital tumors are the most common cause for congenital hydrocephalus. Okay. Then, what are the cause of acquired hydrocephalus? Due to the meningitis, post-meningitis period, there is a chance of developing hydrocephalus. Maybe in case of acute meningitis, acute and chronic meningitis, and in tubercular meningitis. In these conditions, this hydrocephalus can be seen. Okay. And also the posterior fossa tumors. If there is any tumors present in the posterior fossa, there is a chance for acquired hydrocephalus. Okay. Next is the cortical atrophy is the another cause for acquired hydrocephalus. Just read about these diseases. Arnold-Chiari malformation, where the elongation and downward displacement of the cerebellum or the brainstem is happened. So it will block the CSF flow. That is the Arnold-Chiari malformation. Whereas the Dandy-Walker malformation is the cystic malformation of the cerebellum and also the fourth ventricle. It is mainly occurs due to the atresia of the foramen of Luschka and Magendie. Okay, so these two are the cause for congenital hydrocephalus. Okay, so mainly you can see in hydrocephalus, that is Mace-Wen sign. We had discussed earlier, that is crackpot sound is positive on head, and also sunset sign can be seen. And the baby is presenting with vomiting, head banging, and headache. Okay. Then the next disease that you have to study is the cleft lip. What is cleft lip? It is a developmental error in the formation of upper lip that will lead to the formation of cleft lip. Okay, and it is classified in several ways. You can see the simple, compound, or complete or incomplete, complicated or uncomplicated, the central type or lateral type. The lateral type is again divided as unilateral or bilateral. So these are the classification of cleft lip. Mainly the cleft lip may be unilateral or bilateral. Okay. The main treatment choice is surgical management is advised here. So when the baby attains 5 to 6 kg of the body weight, or at the age of 3 months or before the commencement of primary dentition, the operation can be performed. Okay. These are the conditions to do the surgical treatment. Either baby should have the weight of 5 to 6 kg or before the 3 months or before the commencement of primary dentition. Okay. Then coming to cleft palate, that is Gandatalu. It's also a condition, the failure of the fusion of the three basic components which together form the palate. So due to the failure in the fusion of the three components which forms the palate, it results in the formation of cleft palate. So what are the three basic components? The first one, that is premaxilla, and also two palpebral processes, one from each maxillary process. These are the three type of basic components. Their fusion failure is the result in cleft palate. Okay. Mainly the cleft palate is of two type. One is complete and another is incomplete. Whereas in cleft lip is classified in different ways. Okay. So the main complications of cleft palate is difficulty in sucking and difficulty in eating, speech, hearing, and they also have dental problems and defect in smelling, and they have respiratory tract infection, and also chance of aspiration bronchopneumonia. So these are the main complications of cleft palate. So we have to do surgery before 1 to 1.5 years. Okay. The main operation for the cleft palate is Langenbeck's operation or Wardell's operation. So just remember the name of the surgery indicated for cleft palate. One is Wardell's operation and Langenbeck's operation. These are of 2-star important, the name of the surgery. Okay. Then Coming to the other disease, that is spina bifida. You may be heard about this disease. This is also a congenital defect of the spinal cord, which involving the laminas. So it mainly the common anomaly involved the midline defect of the vertebral bodies. Here, the midline defect of the vertebral bodies can be seen. And depending upon the severity of this defect, the protrusion of the contents of the canal is present. And these are the type of spina bifida. That is spina bifida occulta, meningocele, meningomyelocele, syringomyelocele, and myelocele. Okay, this the 5 type of spina bifida is present. The first one is that is spina bifida occulta. Here, it involves the non-fusion of the neural arches. Yet, there is no protrusion of the spinal cord or meninges. Here, there is no protrusion of the spinal cord is present, and it is completely asymptomatic. Okay. But in some other cases, the neurological defects like foot drop or nocturnal enuresis or back may be presented. Otherwise, there is no protrusion of spinal cord is present in spina bifida occulta. Okay. Whereas in meningocele, there occurs a protrusion of the meninges through the defect in the neural arch fusion. So mainly it is present due to the defect in the neural arch fusion. So in spina bifida, there is no protrusion is present. Maybe the baby is asymptomatic, or he may have the defect like foot drop, nocturnal enuresis, and or backache. Okay. And whereas in meningocele, the protrusion of the meninges can be seen, and the protrusion mainly contains the CSF, cerebrospinal fluid. Okay. It is most common in lumbosacral region and maybe occur in skull also. So meningocele is mainly and commonly occur in lumbosacral region, and also it can be occur in skull. Okay. In case of meningomyelocele, here also the spinal cord protrusion is accompanied by meninges. So both the protrusion of meninges and spinal cord is present. The mainly neurological manifestations can be seen, and the symptoms are paralysis of legs or bilateral talus may be present, and urine incontinence can be seen. So these are the symptoms of meningomyelocele. Okay. So the treatment we adopted is mainly surgical treatment. Then coming to the other important disease, that is the congenital hypertrophic pyloric stenosis. The mainly it is a congenital anomaly of the pylorus. It is mainly found in male compared to female, and the etiological factors are abnormal muscle innervation or maternal stress in third trimester, infant hypergastronemia, and elevated serum prostaglandin, and is also associated with the trisomy 18. Okay, so these are the etiological factors. But the important point you have to study in pyloric stenosis is that there's a projectile vomiting can be seen. If a baby is coming in the OPD with a projectile vomiting, note the peculiarity of the vomiting. The projectile, it is in projectile vomiting. Okay, a non-bilious projectile vomiting of the feeds is the main symptom of the pyloric stenosis. Okay. And the baby may have lethargy and emaciation and loss of weight. Due to the projectile vomiting, there is no absorption of any nutrients. Okay, so it result in loss of weight and emaciation. And There may be constipation also present. The stool is small and dry like that of rabbit. That's another peculiar features in pyloric stenosis. Okay. Then on physical examination, you can find pyloric mass, which is firm and mobile, and a smooth mass in the epigastrium can be seen. Okay. Then post-feed visible peristalsis in the upper abdomen from left to right. So you can see a visible peristalsis from left to right after food. Okay. Here also the surgical management is the main treatment. The name of the surgery is Ramsted's operation. Very important. Surgical name is Ramsted operation in pyloric stenosis. Okay. Just remember the name of the surgeries which mentioned in the treatment of diseases. Okay. Then coming to the next disease, that is congenital Talipes equinovarus. Pada Vigrudi. Okay. The Talipes means club foot, and equinus, that is the full dorsiflexion of the foot, which is prevented due to the fixation in the plantar flexion. And varus means the foot is inverted and adducted at the mid-tarsal joint. Then the cause is mainly congenital or acquired causes. The congenital causes includes the intrauterine compression. If there is any intrauterine compression is occurs, it may be result in this equinovarus. Okay. And other things are genetic factors may be present, or dysplasia. The drugs like thalidomide is very important. So the thalidomide is also result in the formation of this disease. Okay. Then the main symptoms are shortening and decreased growth of the muscles and tendons, which involves the flexors of the ankle, inverters of the foot, and tendo achilis. These are the main symptoms. Then it is most common in boys, and it is unilateral in condition, and deformity itself is the diagnostic thing. Okay. Then also the planning of treatment is based on the age of the patient. If so, according the age of patient, we can plan the treatment into 3. That is below 5 years, and in between 5 and 10 years, and above 10 years. Okay. So below 5 years, it is very easy to manage, and the deformity can be corrected by manipulation. Okay. So this is easy in the age group below 2 months. So you can done without any anesthesia. Okay. And in between 5 to 10 years, some bone deformity is prominent. So operations are required. The most common operation is Evans operation. Note the name of that surgery, Evans operation in Talipes equinovarus. And about 10 years, the cuneiform tarsectomy in the conventional management is the conventional management. Okay. So note that operation Evans operation is important here. Okay. Then coming to the other disease, that is Duchenne muscular dystrophy. That's the most common primary myopathy of the children. Mainly, this muscular dystrophies are in many types. Okay, mainly it is Duchenne muscular dystrophy and Becker's muscular dystrophy are the common type. In that, the most common is this Duchenne muscular dystrophy or DMD. Here, the baby is asymptomatic at the time of birth, and the early motor milestones appear at usual time or maybe mildly delayed. So the baby have attain each milestone at the age But in some children, there will be mild delay. And the baby also have poor head control, may be the first sign of weakness. So at the time of birth, he is asymptomatic. But when the first sign of weakness of the poor head control can be seen, we can suspect any muscular dystrophy. Okay. And also the hip girdle muscle weakness is expressed in subtle form as early as 2 years. So that the baby shows the sign that is Gover's sign. That will be positive by the age of 3 years, and it will be fully developed at the age in between 5 to 6 years. So what is Gover's sign? The baby is unable to stand up with the legs. So he use his hand also, and this is due to the weakness of hip girdle muscles. Okay. So the Gover sign is very, very important, which is found in Duchenne muscular dystrophy. Okay. And here also the Trendelenburg gait or waddling gait can be seen. And walking will be continued up to 12 years of life. Then death may be occur at the age of 18. So the baby have a life expectancy of 18 years. Okay. And the complications produced in this muscular dystrophy are cardiomyopathy, and also the muscle weakness, respiratory muscle weakness can be happen. And the baby have learning disabilities, and congestive cardiac failure can be present. Okay. The mainly the diagnostic factor that is measuring the CPK is it is usually rises up to 15K. Okay. And for the further confirmative diagnosis, muscle biopsy is specific. Okay. So in Ayurveda, we mainly taken this as a Mamsa Shosha due to the Bija Dushti. So we adopt the Brahmana treatment. So we can manage this disease by the Brahmana treatment. And we give some medicines that is indicated in Bala Shosha Chigilsa. So that type of Grida and Taila and ointment are also given in this muscular dystrophy. Okay. Then another common type disease, that is diabetes mellitus type 1. You know that diabetes mellitus is of two type 1 and type 2. So in children, it is common type is type 1. The formerly it is known as IDDM, that is insulin dependent diabetes mellitus. So the age of onset of type 1 is in between 7 to 15 years. It is mainly due to the autoimmune destruction of pancreatic beta cells of the pancreas, and some genetic susceptibility and environmental factors also contributed in development of this disease. Okay. So nowadays it is very, very common among the children, the type 1 diabetes mellitus. And the features are polyuria, polydipsia, and polyphagia. There may be weight loss and weakness may be present. Okay. So ketoacidosis is also present by the vomiting, dehydration, and abdominal pain. And there may be rapid respiration, and mainly the fruity odor of acetone can be present in the breath. So in children, due to the uncontrolled diabetes mellitus, the ketoacidosis may be present. So the main feature of this ketoacidosis is the fruity odor of acetone in the breath. Okay. So when a patient is coming in an emergency department with the unconscious, in unconscious mode, then if there is a fruity odor is coming from his breath, then we can make a suspect. We can suspect the ketoacidosis. Okay. So the smell is very important. And also nowadays, the acanthosis nigricans can be seen in the children in the age of 7 to 15 years. So a blackish discoloration on the nape of the neck or axilla. So this is known as acanthosis nigricans. So this indicate the insulin resistance is present in the child. So there is a chance of developing this diabetes in the coming years. So it is very important to study the parents or to teach the parents about the lifestyle of the lifestyle means managing the food and implication of exercise in the daily routine. Okay, so the acanthosis nigricans is mainly indicates the insulin resistance. Okay, then jaundice we have discussed now. It is physiological and pathological jaundice. The pathological jaundice is again divided into obstructive jaundice, hemolytic, infective, and toxic. Okay. So in case of physiological jaundice, the time of onset is from 30 to 72 hours of age, and the maximum intensity of the physiological jaundice is attained in 4th to 5th day of life. Okay, whereas in preterm baby it is occurring 7th day of life, and the bilirubin level in preterm baby does not exceed 15 milligram per deciliter, whereas in preterm baby it may be reach up to 50 milligram per deciliter. And the physiological jaundice is disappear in the 6th day of life, whereas in preterm baby it may be last up to 14th day. Okay, it is quite normal. Okay, then the clinical jaundice or pathological jaundice is present prior to 36 hours of age or within the 24 hours. And it is if the clinical jaundice is persisting more than the 8 days in full-term baby or in 14 days in preterm baby. Okay, so the bilirubin, total serum bilirubin is more than 50 milligram per deciliter in clinical jaundice. Note that. Okay, so the serum bilirubin level is more than 50 milligram in clinical jaundice. So here are some causes of neonatal jaundice based on the age of onset. You just read about this points, okay? Then, if the persistent jaundice is present during the first month, then the causes may be due to the cretinism or congenital hypertrophic pyloric stenosis that we have discussed now about the pyloric stenosis and anticipated bile syndrome. So these three are the cause for the persistent jaundice during the first month of the birth. Okay. Then next important disease, that is opthalmia neonatorum. It is defined as a conjunctivitis, which is developed within the first 4 weeks of the life after birth. So within the first month of life, the baby develop this ophthalmia neonatorum. Okay. So in formal times, it is the cause for the childhood visual disabilities. Now, this has been changed, and there are many organisms which is responsible for producing this ophthalmia neonatorum. The common cause is chlamydia trachomatis. Mainly, it is produced by chlamydia trachomatis and also the Neisseria gonorrhea. These two are very important. Okay. So in case of gonorrhea infection, it is getting from the maternal vaginal passage at the time of birth. Okay. And incubation period is usually 2 to 5 days. And it may be present up to 3 weeks after delivery. So mainly there is a conjunctival edema present and copious purulent greenish discharge, and sometimes blood stain discharge is present. So mainly the type of discharge is either purulent greenish discharge or blood stain discharge. So when it is penetrate into cornea, it may be leading to the blindness. Okay. Then this can be mainly related in Kugunaga. We have studied that disease in our previous classes. So Kugunaga can be related to the ophthalmia neonatal. Okay. Then moving to the other important disease, that is Mastishka Agadam, otherwise known as cerebral palsy. It's nowadays the prevalence of the cerebral palsy is increasing. So it may be caused due to the any events which happen in prenatal life or perinatal period with or without the mental subnormality or sensory deficit. Okay, or without or epilepsy or other involuntary movements. So the other name for the cerebral palsy is Little's disease. So Little CP. The other name is Little's disease. Very important. Okay. Then the causes are prenatal causes such as anoxia. If there is any interference with the placental circulation, or other preeclampsia or eclampsia may be present, and infection at the time of intrauterine life, and some congenital malformation of the brain may be the causative factor for CP. And in natal period, there may be anoxia during the birth process, or as may be present, and breech presentation and cephalopelvic disproportion, or if the mother is given some type of sedatives, are the causes for the natal causes for developing CP. Okay. Then after the postnatal period, the current icterus and some type of trauma for the skull fracture or intracranial hemorrhage, and meningitis, encephalitis, and hypoglycemia, hemorrhage. These all are the cause for developing CP in postnatal period. Okay. Then the clinical features are mainly quadriplegia and hemiplegia or monoplegia or diplegia can be seen. So in 65% of babies have developing the spastic CP. Okay. And the extrapyramidal CP is chorioathetosis, different type of movements as present, and deafness, dystonia may be present. And in atonic CP, there is atonic diplegia and congenital cerebellar ataxia may be seen. And there is also a mixed presentation of this as spasticity, atonicity, and athetosis. Mainly, we can find the spastic CP with the quadriplegia or hemiplegia, or diplegia or monoplegia can be occur. Then another important disease, that is autism. It is very common in today's era. This is understood the psychosis in children, which is characterized by marked deficit in the interpersonal and communication skills. So there is a different interpersonal and communication skills are present in autistic child. Maybe there may be several predisposing factors. Maybe the prenatal complications or Fragile X syndrome may be present, or maternal rubella infection may be the cause for developing autism, or phenylketonuria. These are some predisposing factor. Okay. And also meningitis and encephalitis are also predisposing factors. Then next is ADHD, that is attention deficit hyperactivity disorders. So it is the most prevalent neurodevelopmental dysfunction of the childhood, characterized by inattention, activity and hyperactivity. So mainly the two cardinal features, that is inattention and impulsivity and hyperactivity. So this is a in Ayurveda, this is taken as a manovigara, mainly Vada Pitta Unmada. It is described under Vada Pitta Unmada. So we adopt the chikitsa of Vada Pitta Unmada in ADHD. Okay. And the Vadiga natures we can infer from the emotional instability of the baby, such as tics, convulsions, and exopraxia and echolalia may be present, and talkativeness is present, and less body mass index. So these are the Vadiga nature. And the Paitiga, when coming to the Paitiga, the baby having increased anger and more destructive behavior, and Ubashaya with cool articles, and self-ruining behavior is mainly present. Self-ruining behavior and increased surface temperature, and also there may be discoloration of eye, sclera, or skin can be seen. Okay. Then the diagnostic criteria includes either 1 or 2. The one here is 6 or more of the following symptoms of inattention, which have persisted for more than 6 months to a degree that is maladaptive and inconsistent with the development level. So, if the baby have any 6 symptoms of the following, either he often fails to give close attention to details or make careless mistakes in school, then often has difficulty sustaining attention in task or play activities, and they does not seems to listen when spoken to, and always they fail to finish the school works or duties in the workplace, and they have a difficulty to organize the tasks and activities, and they dislike to engage in the task that requires sustained mental effort, and they lose the things necessary for tasks, and they get easily distracted by external stimuli and easily forget in daily activities. So these are the main features coming under inattention of the child. Okay. If 6 or more of the following symptoms of hyperactivity or impulsivity has persisted for more than 6 months to a degree, then coming to the impulsivity, the baby, if this type of symptoms are present more than 6 months, we can diagnose the baby have ADHD. So mainly we give the cognitive behavioral therapy in this kind of children. Okay, so you just study the clinical features and the causative factors, if there is a specific signs and symptoms, and the name of surgeries which we are mentioned in this session. Okay. Then just note the how we can calculate the height and weight of the baby. So the weight in kilogram can be calculated by the formula. Please write down. That is age in years plus 3, which is multiplied with 2. Age in years plus 3 multiplied with 2. That is the, if the baby have 3 years, then the weight in kilogram we will calculate as age in 3 years, that is 3 plus 3 into 2 equals, that is the weight of in kilogram. Then how we can calculate the height in centimeter? The formula is age in years multiplied with 6 plus 77. Age in years into 6 plus 77. This is the formula to calculate height in centimeter, and the weight in kilogram can be calculated age in years plus 3 into 2. Okay. Then Coming to the dyslexia, some learning disabilities present in the child. The mainly there are three type of learning disabilities, that is dyslexia, dysgraphia, and dyscalculia. Okay, so the dyslexia means the baby found the difficulties in spelling and writing and pronouncing the words. You may have seen the film Tare Zameen Par, isn't it? In that also, in that the child have the learning disability, that is dyslexia. Okay, so here the baby is found difficulty in spelling and writing, also pronouncing words. Often the mistakes are found in these things, and mainly the diagnosis is mainly accomplished from the school itself. Okay. Then the next is dysgraphia. It is also a learning disability where it affects the written expression. Okay. Here the difficulties with the spelling and poor handwriting. The handwriting is not good in this dysgraphic students, and they have trouble putting thoughts on paper. That means they have a difficulty to write the things which is present in their thought. So here also it is known as dysgraphia. So the students with the dysgraphia does not start a sentence with a capital letter, and they don't know how to use the punctuation, commas, etc. And they even cannot complete a sentence, writing a sentence. Okay. So these are the features of the dysgraphic students. And next is dyscalculia. It is the learning disability in math, studying maths. Okay. So they find too hard to doing the basic problems in maths, and especially the right and left confusion. They have confusion to identify what is the right side and left side, and there is a difficulty in spatial relationship. That means up and down, and they have confusion to identify up and down, high and low positions, far and near position. Okay. And they read and write this 3 as 13 or 6 as 9. So this is the features of dyscalculia. Okay. Just learn this name and the features of this learning disabilities. Okay. Then other things, that is sport diagnosis. Some specific signs we have discussed earlier. Now write down some sport present specifically for diseases. The first sport, that is hoarder sport. The spelling is HORDER, hoarder sport. That is present mainly in psittacosis. Psittacosis, the spelling is PSITTACOSIS. So what is this hoarder spot? There is a facial macules which is present over the skin. It is actually resembles the rose spots present in the typhoid fever. And the psittacosis, otherwise known as the parrot fever. It is a zoonotic bacterial infection mainly present in the birds, and it can be transferred from human also. The classical features of the fever, like fever, chills, headache, vomiting, can be also seen. The main feature is hoarder spot. Okay, so write down the code as hard to sit. Hard to sit. Hard here you can take as hoarders, and sit means psittacosis, the disease name, psittacosis. So the code is hard to sit. Then coming to the next sport, that is Koplik sport. You may have heard about this Koplik sport. Commonly is found in measles. Okay, Koplik sport found in measles, which is bluish gray buccal spot. bluish gray buccal spot. That is known as coplic spot. Write down the key as coffee is, we get the coffee from mess. So here coffee means coplic, and the mess here you can take as measles. Okay. And next is rose spots. That is mainly found in typhoid fever, which is present in truncal areas. A rash which is present in truncal areas is known as rose spots. So write down the code as rose tie. The color of the tie which is in rose in color. So tie means typhoid. And the other disease, other spot, that is Roth spot, ROTH apostrophe S, Roth spot, which is found in infective endocarditis. The features of this spot is pale centered retinal infarct. So it is present in retina. So mainly find in acute bacterial endocarditis. Okay. Then the another spot, that is streamer spot. The spelling is SCHEIMER apostrophe S. Streamer spot, which is a soft palate lesion present in rubella. So in rubella, the shimmer spots can be seen. So write down the code as rubella scheme. A new scheme developed, that is rubella scheme. Okay. So you have to study these sport with a 3-star important. That is why I giving this course with each diseases. Okay. I hope you get this code and the name of each sport. Then we are going to discuss an important reflex that is known as let down reflex, LET, let down reflex, which is otherwise known as oxytocin reflex or milk ejection reflex. Okay. So the oxytocin is mainly produced after birth, and it is more quickly produced than prolactin. Okay. So after the production of oxytocin, it makes the milk that is already present in the breast to flow for feeding the baby. That reflex is known as let down reflex. Okay. Due to the action of oxytocin, the milk gets ejected to feed the baby. So this reflex is triggered by the hearing or seeing, thinking about the baby. Okay. So after mainly this hearing, seeing, thinking about the baby, the reflex is increased so that the milk ejection is increased. So in Ayurveda part, we have studied due to the sparshana, darshana, and like these things, the stanya is increased. Okay, you have studied that. So it is equal to the let down reflex in modern. Then another important disease, that is breath holding spells. This is very, very common, commonly find in below 2 years children's. So what happening in this disease? It is a conduct disorders. Maybe due to the child hold his or her breath in the expiration. At the time of expiration, the baby hold his breath. So which leads to the cyanosis, and with or without hypoxia or convulsion. So some babies develop the hypoxia and convulsion also at the time of this breath holding spell. So mainly the parents get frightened due to the action of this baby. Mainly it is occurs within the from 6 months to 5 years in age, and it is common in both sex, both females and male. It is commonly occur. What is the treatment we have to given? Actually, there is no need of treatment as the age advances beyond the 5 years. the incidence of this spell is decreased. Okay, and we have to give the reassurance and the counseling to the parents. So these are the things mainly we have to do in the breath holding spell. Okay. So I think we have covered the main parts of the Kaumarabhritya and also the modern topics we have covered. So I hope you have understand this. Anyone have any doubt? So today we are going to complete the complete session in the Kaumarabhritya. Modern and Ayurveda part is completed. Okay. So study each code. So you have to read these codes regularly. Okay, that then only you will get the proper way of decoding. Okay, then once again I will tell you the weekly examination, the importance of attending weekly examination. Also you have to check the wrong answers, what happened, and you have to study the main points also. Okay, anyone have any doubt, you can ask me. Otherwise we can start our next part, next subject. So can I start the next topic, next subject, the Panchakarma? Are you able to see the screen?